Science 06, the skeletal system. Objectives. At the end of the lesson, you should be able to 1. Identify the major bones of the human body. 2. Understand the function of the skeletal system. 3. Enumerate ailments associated with the skeletal system. 4. Cite the importance of taking care of the skeletal system. What do you think will happen if all the bones in your body will be removed? Correct. You will look like a formless, lumpy object. That is why the skeletal system is important. Having bones arranged properly from your head to toe give your body shape. The bone and the skeletal system. The skeletal system consists of bones, cartilages, and ligaments that perform different functions. In addition to giving shape and supporting weight, it also produces blood cells. It stores and releases nutrients like fats and minerals needed by other organs to function. It protects delicate body organs. It allows the body to move with the help of the muscles. Bones and skeleton. The arrangement of bones in the human body is called the skeleton. A human adult skeleton has 206 bones, while newborn infants have 300 or more bones. These small bones fuse together as babies grow. Bones produce, store, and release. The bones of the human body often have the following parts. The cortical bone fills the hard outer area of the bone. The cancellous bone spongy structure that fills the inside of the bone. In long bones, they are often found at the end parts. Inside the cancellous bone is the bone marrow. The bone marrow fills the spaces within the cancellous bone and has blood vessels. It can be a red or yellow bone marrow. The red bone marrow produces the blood cells, while the yellow bone marrow stores and releases fats that you need for energy. You were born with all your bones only having red bone marrow. As you grow to become an adult, some of the long bones of your upper and lower limbs develop yellow bone marrows. The human skeleton can be divided into the axial skeleton, that protects your organs and includes the bones of the head and the torso, and the appendicular skeleton that helps you move, and includes the bones of the upper and lower limbs. Axial skeleton. Protective bones. It includes the bones of the head such as the cranium that protects the brain, the facial bones that protect the structures connected to the eyes, nose, mouth, and ears, zygomatic bone or the cheekbone that protects the side of the face and eyes, maxilla bone that protects the middle of face, nasal bone that supports and forms the nose, lacrimal bone that supports the tear production body part when crying, mandible that supports the lower teeth and allows the chewing action of the mouth, which is also the strongest bone of the skull. The skull houses the smallest bones of the body, which are the malleus or hammer, incus or anvil, and stapes or stirrup, that help in processing the sound energy passing through the ears. Sternum, or breastbone, holds the ribs and is connected to the upper limb through the clavicle. A long, flat bone running at the middle of the chest. Ribs protect the lungs, liver, and the heart. Form a cage-like curved structure attached to the sternum. The spinal column or backbone that protects the spinal cord. It consists of 33 irregularly shaped hollow bones called vertebra. Appendicular skeleton. Bones for movement. It includes the bones of the pectoral area, upper limb, pelvic area, and the lower limb. The pectoral area connects the upper limb to the torso. Its bones include the clavicle or collarbone that connects the torso through the sternum, and the upper limb through the scapula. The scapula or shoulder blades that allows different ways to move the shoulder area. The upper limb allows you to hold objects, do movements that extend your body, and other upper body movements. Its bones include the humerus, arm bone, and the radius, and ulna, paired forearm bones that allow different arm movements. The carpals, wrist bone, metacarpals, bone of the base of the hand, and phalanges, finger bone, that allow the hands to move and hold objects. The pelvic area supports the weight of the upper body, especially when sitting, and connects the lower limb to the torso and upper body. For females, it supports pregnancy and birthing. It includes the right and left hip bone, the sacrum, and the coccyx, tailbone. The lower limb allows you to walk, sit, and perform other lower limb movements. It also supports your weight while moving your body. It includes the femur, thigh bone, the fibula and tibia, paired leg bones, the patella, kneecap, the tarsals, ankle bones, metatarsals, bone of the foot, and phalanges, toe bones. Joints, cartilage, and ligaments. Joints are areas where two or more bones meet to allow movement for appendicular skeleton and strengthen support for axial skeleton in the joints. You will find the soft cartilage of each bone that provides cushioning support, the ligaments that binds the two or more bones being connected, and tendons that connect muscles to the bones. Joints can be immovable or fixed joints, slightly movable joints, and movable joints. Immovable joint or fixed joints that only allow very slight movement or no movement at joint locations. These joints are important for stability and protection. Example: joints of the facial bones excluding the jawbone. Slightly movable joints are found in the backbone between the ribs and the breastbone. It allows limited movement of the backbone such as chest expansion while breathing. Movable joints, also known as synovial joints, allow movement in different directions. Types of movable joints include hinge joint that allows movement in one direction and plane. It resembles the opening and closing of door. Example: your knee joint. Ball and socket joints that look like one of the bones ends in a ball that fits into a hole or socket in the other bone. Example: femur and upper arms bone. Pivot joint connects the skull and spine. It allows the head to rotate and move upwards and downwards. Gliding or sliding joints are plane joints that are found on the wrist and ankles. It allows movement of hand and foot from side to side and backwards and forwards. Saddle joints allow back and forth and side to side movement but not rotation. Example: the joint at the base of your thumb. Condyloid joints allow movement but not rotation. Examples: finger joints and your jaw. To keep your skeletal system healthy. 1. Eat and drink calcium-rich foods and vitamin D-rich foods. 2. Use safety gears to avoid bone injuries when playing sports like football, skating, and cycling. 3. Regularly do physical activities or exercises to build healthy bones. 4. Get enough safe exposure to sunlight. Here are some disorders of the skeletal system that may result from unhealthy conditions and injury. Scoliosis is an abnormal curvature of the spine that may cause back pain. A person with scoliosis tends to lean to one side, hence showing unbalanced shoulders. Experts still study the cause of scoliosis, especially for children, but for adults, it is often linked to osteoporosis or other elderly conditions. Rickets is the weakening and deforming of bones because of vitamin D deficiency. Lack of exposure to sunlight may cause rickets. Sunlight activates vitamin D that is needed for the body to use calcium. Osteoporosis is the weakening of bones because of phosphorus and calcium deficiency, which often experienced by adults and the elderly. Bones became brittle, thin, and more prone to fractures. Sprain occurs when joints, bones, and ligaments receive too much pressure, causing the ligament to overstretch. It commonly occurs in the ankles, knees, shoulders, waist, and fingers. Dislocation is misaligned bones. It may happen when joints receive high impact force enough to move one of the connected bones out of alignment. Fracture is broken bone. It may happen when bones receive high impact force enough to break the outer covering of the bone. Orthopedic doctor, or doctors that can help you treat problems in the skeletal system. Practice exercise. Choose the correct answer on each number. 1. Which of the following bones protect the brain? Correct. It's the skull. 2. Which component of the skeletal system holds two bones together? Correct. It's the ligament. 3. Which component of the skeletal system provides cushioning for the bones? Correct. It's the cartilage. 4. Which of the following is not a function of the skeletal system? Correct. The skeletal system does not transport oxygen and food to the different parts of the body. 5. Which is not found in joints? Correct. Bone marrow is not found in joints. End of lesson.